It is not difficult to see the lack of family planning in some Nigerian communities. On the outskirts of Lagos in Makoko, this lack of planning reflects glaringly on the lives of the innocent. These children are from both polygamous and monogamous families, where little attention is paid to family planning. World Health Organization statistics say worldwide there are 76 million unintended pregnancies annually, and most of them could be avoided through family planning. Nigeria currently has 144 million people, but only 4.3 million people are using contraceptives. This ranks Nigeria among the countries with the highest need for contraception. While many Nigerians have a limited knowledge of family planning methods, others argue about the safety of the methods. Anu Adebanwo is a mother of 6.
Did you do family planning, any of the methods?
No.
Why?
I don't know family planning.
Okay, you didn't know anything about family planning when you were still giving birth to your children. Yeah?
Yes.
The densely populated Makoko community is home to about 1 million people. The traditional ruler of the community says that a leading cause of so many unintended pregnancies is that too many men are marrying multiple women and impregnating all of them.
Suppose she married 10 wives in this coast, 10 wives. She married. That people who born 77 for different kind of work.
For many years, the funding of family planning in Nigeria has been largely donor-driven. However, donors say if the country is to rapidly meet the Millennium Development Goals of eradicating poverty and reducing maternal and child mortality, the Nigerian government must take the lead on funding family planning. These suggestions originate from the dearth of birth control drugs in government hospitals and the more than 750,000 abortions carried out annually in Nigeria. Mrs. Stella Akinshaw, a representative of the Nigerian Urban Reproductive Health Initiative, or NORI, an organization funded by the Bill and Melinda Gates Foundation, presented some of the realities that must be faced on family planning in Nigeria.
When we talk about development, the government should be in the driving seat. It is not the donor. Of the 750,000 abortions in Nigeria, 40% of them can lead to death, and close to 70% are attributable to young people. So if we do family planning, then we'll be able to reduce 40% of the deaths.
Friday Okonofor, a representative of the Ford Foundation, says if family planning is to be effectively entrenched in Nigeria, socio-cultural beliefs against it must be set aside for tackling the realities on ground. Targeting and educating children in schools on family planning is very important.
There are ways you can talk to them about life attainment. It's not necessarily that you talk to them about sexuality, but you need to tell them that in life the best option is for you to aim to reach your highest level of development, and that you shouldn't allow anything to stop you. If you start with that premise, you'll be surprised that young people pick it up.
Family planning helps to ensure that families do not overpopulate and children are well cared for. It helps young people make better informed decisions about their sexual habits. Medical experts say that planning also helps to prevent reproductive tract infections in women while preventing maternal and child mortality. Officials also say that it will help government reduce national poverty. However, women in Nigeria say the disturbing situation with unintended pregnancies should get the same attention from the government as HIV and AIDS. For VOA, Jacqueline Ogo, reporting from Lagos, Nigeria.